So today's Cardinal lesson, Medicare 101, sign up and the insurance that you need to purchase to go along with Medicare or to replace your Medicare. So, and we're going to be using this book as a guide. Most of you folks that are on Medicare, you just received this book, or I just received mine in the last couple of weeks. So everything we're going to talk about today is given within the context of this book. And the page numbers are indicated uh, up here in orange in the particular section. So if you want to listen to us talk and you want to go find the reference material in the book called Medicare and You 2025. So I'm going to put it to Tom, and Tom's going to share with you why we're doing this video today.
Yeah, I mean, we're doing this video because Medicare is confusing and it has a lot of decisions that you have to make. And if you make them incorrectly or in the wrong order, you're going to end up in the wrong spot that could impact the rest of your life. And so it's important that you get these right. And so we want to go through. And the other thing I will say is if you try to pick up that book that Hans held up, the Medicare and You book, and you tried to read through that to figure out how this works, you're going to walk away more confused than you started. And so they don't do a very good job explaining it. So we're going to go through, we're going to walk you through sort of step by step what you need to do and really get you to be able to think of this correctly and make the right decisions. And so let me bring up the show notes here. They're at the link below our video. They're also on our website. We have the board as always, and then we actually have a PDF copy of this Medicare and You book. I mean, it's hundreds of pages long, so I'm not going to flip through all of these. We'll hit on a couple pages as we go through the board here. But if you don't have the physical copy and you want to go look at a digital copy, we have it here in the show notes for you.
Okay. In the past, we've made separate videos for the people that are already on Medicare, and we told you what we think you need to learn about Medicare. And then we made another video for the people that were just coming up to Medicare and signing up for A and B. This time, we've put it all together in one. And you really, if you're not on Medicare and it's coming up, you're turning 65, you're getting ready to retire, and all these decisions are for you, you're going to need to stay up here in the first decision is like, when do I sign up for Medicare Part A and Part B? And it's important that you get this right. And then we're going to talk about all that in a little bit in those decisions. And then once you get those made, then you got another set of decisions to make. And it's around, are you going to be on, are you going to stay on original Medicare, which is what you signed up for here, parts A and B? That's original Medicare. You're going to stay there and buy a supplement? Or are you going to take your Medicare and turn it into a Medicare Advantage plan? So if you're new to Medicare, this is the second set of decisions. If you're already on Medicare, you get a chance every fall of the year, October, November, and a little bit of December, where you can, if you're here, you can go back to here, original Medicare. If you're on original Medicare and you want to go here, so you can go back and forth during a season of the year. And we're going to get into the details of all of that. And then the third set of decisions is, what's the insurance company that you're going to use to provide either your supplemental coverage, and which plan are you going to buy, who are you going to buy it from, how much you're going to pay for it, or if you've made this decision to go onto a Medicare Advantage plan, which insurance company are you going to use as your substitute for Medicare. So Tom's going to get into a lot of details on that. I'm going to just jump right in, and I'm going to cover this first section, when to sign up for Medicare Parts A and B. For a lot of people, this is when they're turning 65. So, if you're turning 65 in like June of 2025, so, that's just picking a date during the year of 2025, then like February 1st, March 1st is going to be an important date for you. It's really March 1st is the first time that you can sign up for Medicare Part A and Part B, and then it'll go in effect on June 1st. So 90 days in advance, if you're in your initial enrollment period, 3 months before that, your birth month. And so 3 months before that is the first time you can sign up. The effective date will be June 1st in that example. And if you miss that date, you've got all the way till the end of August, excuse me, the end of September, because it's the 3 months before, the month of, and 3 months after where the government allows you to enroll in Medicare without penalties. Okay, so you need to get that right. If you get it wrong, you're going to face delays in getting in Medicare, and you're going to pay penalties for late enrollment. Now, unless you fall under an exception. So you're granted from the government a special enrollment period if either you have Medicare, excuse me, you have Medicare medical insurance, group insurance, you're still working. So this same person that's turning 65 in June of 2025, if they're still working and plan to keep working, and their plan now is to stay working until 67, 68, 69, whatever point beyond there, and their group insurance is what's called creditable, and it needs to cover a group of 20 or more employees, you're going to be able to delay your enrollment in Medicare and avoid penalties until the date your group insurance ends, which presumably is going to be when you retire. So group insurance is the only exception for that. Groups of 20 or more, is the government is not going to require you to sign up for Medicare if you have a creditable substitute. Okay. And by the way, that doesn't include COBRA. So if you've left your job, but you're eligible for COBRA and it's being paid, COBRA is not creditable coverage, nor is the Affordable Care Act coverage. So the only exception to this requirement to get Medicare right at your 65th birthday or right around that is group insurance, creditable from you or your spouse. Now, if you're turning 65, you're already retired, but your spouse is still working and covering you on group insurance, you fall into the same exception. So I don't want to dwell on this, as if you have questions about it, you can just get in touch with us. We work in all 50 states and the District of Columbia, and we provide service by Zoom or phone, and we'll provide consulting. Now, the late enrollment penalties for getting this wrong, we're not going to get into the details of them. They're in this book if you really want to read about them. We can go over them when we're consulting and tell you what they would be for you, but presumably you'll come to us for consulting to just avoid the penalties. I want to point out that the penalties are lifetime. That's what Tom was talking about. You get this stuff wrong, and then you later get Medicare, you're going to have a little trouble getting it, and then you're going to pay a penalty for late sign up, and you're going to pay that penalty for the rest of your life. So you want to get this right. And then you also, there's a consideration that I want to bring right in here into the sign up. It's around this thing called IRMA. We have other videos on IRMA. IRMA stands for Income Related Monthly Adjustment Amount. And it's in the book. It talks a little bit about IRMA, but we have other videos that we do, and we do them every year. We do more than one. And IRMA is for people that have a high income in retirement, or it's really a high income 2 years ago, because they use your tax return. Like in 2025, they'll be using your 2023 tax return. And if it's high, and that is defined in 2025 as for a single over 106,000 or for a married over 212,000, you're going to pay this surcharge, and it can be quite substantial. So that might enter into your decision about sign up, is if you have the option of staying on your group beyond 65 or keeping your spouse on the group, you can delay IRMA by staying on the group and not signing up for Medicare and avoid the penalties as well. So you're going to want to call us for consulting if you really want to just walk through this logically. And so I want to bring Tom on, and I want Tom to comment a little bit on the enrollment periods, and then he's going to get into the second set of decisions.
Yeah, I mean, I think on this enrollment period, I see this all the time where people are still working and they get all this letters and mail when they're 65. They're on their group coverage. It has more than 20 employees, so they don't have to sign up for Medicare, but they are scared. They are scared that they're going to have this penalty for the rest of their lives, and they go ahead and just sign up because I don't want a penalty, right? I mean, penalties scare people, and which I understand, but now it causes other issues, right? I mean, the effective date of your Part B starts your open enrollment for the Medicare supplement, which we'll get to in a second. And so sometimes they've done that and they've shot themselves in the foot because they can't use it later on because they might work a couple more years. And so I don't want to get all into the details. There's some other guaranteed issue periods, but at the end of the day, if you have coverage from an employer that has more than 20 employees, you do not have to sign up for Medicare. You can delay that decision down the road. And if you're a spouse of someone who's working and you're on that group coverage, you can delay Medicare. You do not have to sign up. And I see it all the time. People sign up when they don't have to. They pay this cost. They might be paying IRMA when they really shouldn't have signed up. So just really, if that's you, I want you to really consider that. And if you have questions, just call us and we can sort of walk you through that. And so now that we're sort of done with the first decision, we've made the decision whether you sign up or not. And let's say now we're going to go to the second decision. So you did need to sign up, right? You didn't have credible coverage. You need to sign up for Medicare. You went ahead and signed up. Now we get down to the second decision. And this is a binary choice. And a lot of people don't understand this, is now you have to decide whether you go with the Medicare, original Medicare and a Medicare supplement, which is the left side of the board, or a Medicare Advantage plan, which is the right side of the board. And that's where you are giving sort of the Medicare coverage to a private insurance company and removing you from original Medicare. And you cannot have both. You cannot be on both paths. It's one or the other. So let's start on the left side, original Medicare and a Medicare supplement. This is where you keep Part A and Part B. That's what we would consider original Medicare, or what's called original Medicare. Part A covers your hospitalization. Part B covers sort of the doctor visits and outpatient stuff and other things. So you can read through the guide and get a little more information of what's under Part A, what's under Part B. But essentially, those are the two pieces of it. The reason you need a Medicare supplement with that is that only covers so much, right? It covers, for under Part B, it covers about 80% of the cost after you meet the deductible and those things. But the other 20% is left to you. You have to pay that other 20%. And there is no cap to that 20%. It's an unlimited exposure, unlimited liability from your standpoint if you have really large Part B expenses. And so what the supplement does is it comes in and picks up what original Medicare doesn't cover. And so let me rephrase that. What a Medicare has approved but hasn't covered. So because there's some things that Medicare won't pay for, the supplement won't pay for either. But as long as Medicare approved it, they paid their portion, the supplement will pick up the rest. And so one of the other things that the government has done is they have standardized all these supplements. And so, they give them a letter, A through N, and there's some missing letters along the way. I'll show you that in a second. But a G plan is the most comprehensive coverage available for people who are turning 65 now and signing up. If you've been on Medicare a while, there's an F plan that was more comprehensive. But the supplement, if you have a G plan is a G plan is a G plan, no matter who the company is that's offering it. They're all identical. The coverage is identical no matter what. And so that makes it easy to compare, right? We're not having to compare price versus benefits or anything. It's like, I know what the benefits are. Those are standard. Now we're just looking at the cost. And so I want to bring up the show notes just real quick. This is the chart that's in the Medicare and You book. It's on page 76. And like Hans mentioned, on the board, we have the page numbers next to each section. But you'll notice these are the plans available, the Medicare supplement plans. We've highlighted the G plan. That's mostly what we're selling. Consumers. Some will buy an in plan. We can get into more details if you want. Just give us a call. But the G plan is what most people have. It's what Hans bought when he turned 65. And you'll notice that it covers 100% of everything except this Part B deductible. One of the things that you'll notice across the board, most of them don't cover the Part B deductible. The F plan is still here. If you were on Medicare prior to 2020, the F plan's available. If you're on after 2020, it's not. But the only difference between the F plan and the G plan is this Part B deductible. For 2025, that's going up to $185 a year. Once you have met that deductible, you're good. Actually, that might be the premium for Part B. That's a Part
That's
B
the
premium.
premium. Yeah.
Yeah. So the 185 is a Part B premium. I think it's like 257
Yeah,
is
it's right
the
here, 257.
257 is the Part B deductible. So the Part B deductible is 257 for the year. Once you have met that, you're done. I mean, you don't have to cover anything else. If you've been watching the show, you know Hans hurt his knee earlier in the year, had surgery, was in a leg brace for a while. I mean, a lot of cost. His only expense he had to pay, including therapy, including everything, was the Part B deductible, which for 2024 was $240. So again, it is really good coverage. And one of the other benefits of original Medicare and a Medicare supplement is your choice of doctors. You can see any doctor that takes Medicare. There is no networks. You don't have to check, does this doctor take my plan? If they take Medicare, they have to take the plan regardless of where you are. You could be traveling to visit children in a different state. You could be wanting to go to the Mayo Clinic. I mean, it doesn't matter. As long as they take Medicare, they will take the supplement and you do not have to worry about the networks. And that is really one of the main benefits of the Medicare supplement and original Medicare route. So we have some other videos where we go into that. What I want to now do is switch over, and we'll go back to the board. We'll switch over to the right side of the board. So that's original Medicare, a Medicare supplement. The other decision, the other route you can go is a Medicare Advantage plan. This is where you are privatizing your Medicare coverage. So you still have to pay for Medicare, that 185 Part B premium that everyone has to pay for Medicare. You still have to pay that, but you aren't getting any coverage from A and B. What Medicare is doing behind the scenes is they're paying this company a lot of money sort of to take over your responsibility. And that's, you'll see a lot of ads around this time of year, in the fall of the year, talking about Medicare Advantage plan. But what you're doing is you're taking a private company. They are providing the coverage. These plans will have networks, right? An HMO, you have to stay in the network. A PPO, you can go out of network just with a higher cost sharing. But you have networks that you have to worry about. You'll have lower cost, right? There's a lot of Advantage plans that are $0 a month compared to what the supplement route might be, 150 or so. We'll get to that actually in a second, the price of the stuff. But a lot of them are $0 on the Medicare Advantage plan, again, specific to your area. They add some additional benefits, right? There might be vision, there might be dental, typically not real comprehensive, but some coverage there. And then they have like gym memberships, and they have some of these other added benefits, which are on the surface seem really nice. But if you were to get sick, you're going to have co-pays, you're going to have out-of-pocket costs that you have to meet and pay. So if someone who knows that they're going to have high costs, maybe they have some chronic condition where they go to the doctor often, or maybe like for me, if you've watched the show, I have an autoimmune disease. I get monthly infusions that cost $10,000 a month. I mean, I'm going to hit the max out of pocket on the Advantage plan every year just because the costs are so high. For me, I would go the supplement route just because I know it's all covered. But the Advantage plan for healthy people, it can work pretty well. One of the things that I want to make the point is if you go the Advantage plan route and you were to get sick in the future and you're like, hey, I actually want to go back to the supplement now. Like now I got more costs than I did before. I don't really like the Advantage plan anymore. I want to go back to the supplement. You have to go through underwriting at that point. And so that is a real thing that you need to consider if you choose the Advantage plan route. It could be harder to get back to the supplement down the road. And so, again, there's just different ways to do it. The biggest, if I just had to summarize the two routes, supplements are going to be more expensive. They're going to have better coverage. They're going to have no networks. The Advantage plans are less expensive. You have to deal with networks, and there's out-of-pocket costs if you use them. But you do get some of these additional benefits. And so, I mean, we could spend hours talking about these differences, and I know we need to get to some of these other decisions, but I want to see if Hans has anything to add on that second set of decisions here.
Well, I do, because we have a lot of people that are on Medicare for a few years, and we interview them when they're coming in, and a lot of them have difficulty telling us which side they're on. I mean, we can ask them a few questions. If they can show us their card, we can put it together, but it just tells me that this decision was just skipped over when they were first going on Medicare. They called up a company, they got in touch with somebody, and whatever plan that person or that company sold is kind of where they are. So I just want people to understand this is a decision that's a binary decision, as Tom said. You're either here or you're here. The other thing that I see is people coming into us and they're telling us about their situation and what they want, and they're talking about, they're like over here on original Medicare and they have a supplement, but they're inferring things that are over on this side, or rules that are over on this side, or benefits, or vice versa. There's people that are over here and they're calling this a supplement. So pay attention to this middle area is the difference between both sides. And I want to summarize it for a lot of our people that are coming through here is on this side, you have no networks. You're dealing directly with Medicare, and Medicare is probably the widest network in the country because any doctor or hospital that takes Medicare, you can go see them. They accept Medicare, and there's few that don't. Some plastic surgeons, some people, but you're really, you're going to have a different kind of business plan if you don't take Medicare. So just look around in the waiting room when you go in to see the doctor and see who's in there. There are a bunch of Medicare recipients. So on this side, you have no networks. And this is one of the points that a lot of people that have this and a supplement, they think that they've got to make sure the doctor takes this supplement. You don't. This is if the doctor accepts Medicare, your supplement is just an afterthought. Over on this side, you're going to have a network, and if it's a PPO, you can go into the network or you can go out of the network. You're just going to pay more out of the network. But if it's an HMO, you have to go to the network, or you're not going to get anything. You're not going to get treatment unless it's an emergency. They have an exception for that. So, to me, that's the biggest distinction between the two. Another point that I want to make is you're paying this in 2025. It's going to $185 a month for Medicare Part B. That's the premium that 93% of the Medicare beneficiaries pay in 2025. And in addition to that, you could pay IRMA. So if you're a high income person that we talked about earlier, then you're going to pay more than 185. But the point I wanted to make is you pay that on this side just to get Part B. If you take your Medicare and turn it into an Advantage plan, you're still paying that $185 a month plus IRMA. So that's to Medicare. Doesn't matter which side you're on. People get confused by that. And I only put these other numbers up here because a lot of people just looking at this, what they want from us early on is what's the monthly out of cost, out of pocket? How much am I going to pay in premiums on this side and on this side? And we just put together a little estimate. And you're going to pay Medicare $185 a month if you're like most people, but you're going to possibly pay some IRMA if you're a high income person. But I got 185, and you're going to pay about $50 a month. That used to be like last year, like $10 a month or $20 a month. They've gone way up in 2025 on average. I just threw in $50 a month for your Part D drug plan, a Medicare supplement. So Tom is going to go in later and he's going to show you how you can shop for these. And in a lot of states, you can get it for less than 150. In some states, it's going to be more than that. But I threw in, there's a premium for that. And I threw in dental and vision, which is optional. You buy it privately, and you're going to get a better dental and vision plan for $75 a month than you're going to get for free over here with the Medicare Advantage plan. But I just put in something that people that do get dental, I just put in a price that leaves a lot of room to buy a better plan. And all of that adds up to $460 a month. And on average for people that get the whole package. And over on this side, the only thing you're really paying on a lot of these plans that don't have a premium, they have a zero premium, you're just going to be paying the $185 a month for Medicare. So this could be a lot less costly by the month. Now, when you get sick, you're going to end up better off over here with the supplement and original Medicare and go to any doctor you want. You're going to have a lot of copays and deductibles and daily amounts. So this cost savings kind of reverses if you have a big claim. So I want to push it back to Tom, and he wants to talk about the third category is choosing your insurance company and then choosing your plan.
Yeah, and so and I think like I had mentioned like in the very beginning of the video, it's important that you make these decisions in the correct order, right? Is, one, should I sign up for Medicare or should I not? If I do sign up, we go to the second decision. Do we go with Medicare supplement or a Medicare Advantage plan? And then the third decision is which company. What we often see is people start with the third decision and say, all right, which company do I need? And it's like, before we get there, we need to figure out the first two decisions. And so that's where you can get this in the wrong order. And so a lot of times you just want to make sure you're doing it in the correct order. So number three decision is we'll start on the left side of the board. Again, you've signed up for Medicare. You've chosen to go the Medicare supplement route. Now we need to pick a company. If you remember back, they're all standardized. A G plan is a G plan is a G plan. So the coverage is identical if you've chosen the G plan. And now it's just which company is going to give me sort of the price for that, because the pricing can change, right? The only difference between the G plans is the price that companies charge. We actually have a calculator on our website that will show you, and you can actually run this on your own. You don't have to give us any of your information. You don't have to put in your email, nothing. I mean, you can go to our website. I'll show you how to do this and run these quotes yourself. So let me bring that up. We're going to go over to our website here. It's cardinalguide.com. Let me actually just walk you through it if you were just to go there right up front. So you go to cardinalguide.com. I mean, if you go there, you're going to go to the sort of the 7 worries section, and you're going to scroll down, and there's one that's called Medicare. If we click on Medicare, it pulls you to the site here that talks about Medicare. And if you scroll down, there's a start free comparison. This is where you can type in a zip code. So I'll start with the zip code here in our office, 27713. Again, that's our Durham zip code here. We'll run it for a 65-year-old. We'll do male. If you're female, the prices are going to be a little bit less expensive. I'm going to assume that we're not using any tobacco, but if you are, you'd want to put that there, and we'll hit run comparison. Takes you to sort of a second screen. It loads the results, and you can see based off the price. Now, one of the things that I will just caution you a little bit is some of these companies will offer discounts that we haven't applied to any of these yet. Specifically, like if you are married or you live with somebody or your spouse is signing up, some of these companies will give you a lower price. But you can just go and see. So a 65-year-old male here in North Carolina could go with Allstate for as low as $113 a month. I mean, you can see the prices sort of go up from there. We have AARP at 140, we have Aetna at 138. I mean, you can sort of see what the pricing is here from there. On our website, we have the ability, you can plug in your zip code. If I go back to the show notes, I actually, at the very bottom of the show notes, I ran these quotes previously. And so if you want to look at this, I just want to give you a sense of what the price is differently and the different areas. So here's someone in Florida. Florida is a little bit more expensive, right? And again, this is dependent upon where you live, what state you're in. Sometimes the states have different prices based off the zip code. So this is in Tampa, Florida, or as high as almost getting up around $200 a month, right? So it can be more expensive. If we go down, here's one. This is the North Carolina one. Here's Texas. Texas is more similar to North Carolina from a pricing standpoint. Again, depending on where you are in Texas, it can change. Some of the areas of Texas are more expensive, and then California, sort of in between there. So just to give you a sense of the varying prices based off where you live, and it can vary somewhat widely. And so you want to look at the price specific to your location, your age, male or female, and those things. And if you don't want to do all that, you can call us and we can run through a quote with you to give you an idea of what that cost would be. If we go back to the board, on the right side of the board, so we have similar software that can run the Medicare Advantage plan quotes. We don't have it consumer facing right now. So we can, if you call us, we can run you a very similar type of quote there where we look at all the options available, help pick theirs. Those ones we need to be a lot more careful of what doctors you see, making sure that they're in network, and there's a little bit more work. It's not as easy to compare side by side just because the benefits are different, the networks are different, pricing is different. And so it needs to be really specific to you on the Medicare Advantage plan side.
Okay, well, my friend Al from Arizona, he asked me, he says, I want to know what the butcher takes home on Saturday night and feeds his family. And what he was doing is what plan did you do? And I just told him Plan G, original Medicare, uh, a high-end dental plan. And I did this from AARP United Healthcare because they give you access to a fitness membership, which is a great deal for people that want it. So that's what the butcher cooks for his family. And so, well, I just want to make one final point on this whole subject is that long-term care is right down here at the bottom of the board. And we have at least 15, 20 videos about long-term care. And some of the more recent ones go into a lot of detail. This is potentially a bigger problem for you and what you need to be focused on than all of this health insurance business. And we can certainly do that for you. We're in all 50 states in the District of Columbia. Be glad to help you. Within the context of financial planning, we get people that ask us, especially industry people, when we're going to meetings, they ask us, what are a couple of CFPs just doing around mucking around with Medicare? That's not typically things that CFPs are concerned. And I'm just telling you, our clients are retired people. They're very concerned, even if they have a great amount of wealth. This whole IRMA thing and the no network thing, this is real relevant to people, wealthy people of average means, people of little means. Yeah, we help all of them. This whole area of Medicare fits right nice and neatly in the area of financial planning. So I'd like to bring Tom back on. I'm Hans Scheil.
And I'm Tom Griffith.
And we thank you very much for listening.
Thank you.